We've actually discovered there are more than 1,000 forms of gluten. So when we use the term gluten, we use it as a singular term, but it's actually gluten is a family of proteins. So, corn has its own family of glutens, rice has its own family of glutens, and these glutens are very similar from one grain to the other. And what we get, and some people react to the rice gluten, some people are reacting to the corn gluten more aggressively than they're reacting to the wheat gluten, but they're being told corn and rice are gluten-free products. So people with gluten sensitivity, their normal response to consumption of grain is actually an inflammatory response. The body is rejecting it. So in part of that rejection, it's attacking it and creating an inflammatory response to get rid of it. For many people, the grain itself actually induces hormonal change. Because it creates inflammation, it causes your body's normal response to it is to try to make more cortisol. Cortisol is the hormone we make to fight inflammation.
Hey folks, it's Mike Mutzel here with highintensityhealth.com. Thank you so much for tuning back in episode number 126. And today we're live with my friend, Dr. Peter Osborne. He has a great new book out called No Grain, No Pain. And he's going to talk all about the book today and give you some ideas and concepts and help you eliminate pain. And I myself have suffered from back pain from overuse and exercise and found that when I eat not real food and processed food, my pain does come back. So there's a lot of truth to this, and I know you guys probably experienced this in your own life, but he's going to provide a lot of tips. And for example, I think we can start off, Dr. Peter Osborne, with grainflamation, and that's one of the concepts that I learned from your book. Maybe if you could explain what that is and this link between grain consumption and pain.
Yeah, so grainflamation is kind of a broad term. We can dive into the nichiness of it, but there are a number of different mechanisms where grain consumption can induce an inflammatory state. And one of the primary ones, which probably your audience is very familiar with, is this concept known as gluten sensitivity, which is extremely popular. We've got a gluten-free aisle in most major grocery stores at this point, so it's not an unheard of term. Or used to be, you'd get looked at like you're a witch doctor if you brought up gluten, but today it's pretty widely accepted, even in the scientific communities. So people with gluten sensitivity, their normal response to consumption of grain is actually an inflammatory response. The body is rejecting it. So in part of that rejection, it's attacking it and creating an inflammatory response to get rid of it. And so that's one aspect of grainflamation. But there are several other forms of grainflamation. One of the other ones that's very commonly missed is the element that grains are very, very rich in mycotoxins. These are toxins produced as a result of chronic mold exposure. So when grains are stored in our farming environment today, grains are generally stored in large silos where they're kept for long periods of time before they're actually processed and sent out. And this creates a lot of mold growth. And in that process of mold growth, mold creates chemical backdrop toxins. These toxins are called mycotoxins. There are a number of different kinds. Probably one of the more common one is aflatoxin. There's another one called fumonisn, which is notoriously found in wheat and corn. And so these mycotoxins, just like so many people are allergic to molds, so many people are allergic to the molds and the mold toxins that are found within the grain products. And so maybe somebody who's not even gluten sensitive would react to bread, or would react to a bread or pasta or cereal-based product because they're reacting to a mycotoxin or to a mold toxin, and that's just another element to inflammation. Then you have the pesticide exposure. The huge quantity of pesticides that are used in farming today. As a matter of fact, one of the things we see repetitively, if you ever, I don't know if you're in tune with this, but you'll see kind of a farmer out in the field with the application of pesticides is actually wearing one of these chem warfare suits, right, to protect them from being totally coated in a severe poison. And yet we're putting that in the food supply, and we're saying, hey, this is generally a safe thing for people to eat 8 to 10 servings of every day. And the reality is many of these pesticides, well, atrazine is one of them. It's a weed killer, and it works like an estrogen. And part of the process is that in at least in amphibious creatures, it causes the men to become women because of its estrogenic effect. So it actually, the male fish start laying eggs, the male salamanders start laying eggs. So we get this kind of sex change, gender change, chemically induced as a result of atrazine. But beyond that, we've got this other one called Roundup, or otherwise known as glyphosate, which is a severe toxin on the gut. It can cause leaky gut. It can cause microbial imbalance in the gut. It can lead to mineral malabsorption in the gut. So there's all these processes that basically contribute to the inflammatory cascades. And so grainflamation is those are some of the mechanisms I talk about in the book. There are more, but those are, three really big ones that I think people should be very aware of and concerned about, especially considering our government recommends such a severe quantity of grains in the diet as a staple. And generally speaking, most people feel like whole grains are a healthy thing to eat, and that this whole gluten-free thing is it's really quite kind of fringe or quite like radical. But realize that it has more to do with than just gluten. It's the grainflamation. It's all the other components to the grain, not just the gluten itself.
Yeah, that's really important. I don't think anyone's really talking about that, the atrazine, glyphosate, and the mold. So let's talk about gluten a little bit, because I think that's an important aspect of the conversation. But how, like you were just kind of leading into, that gluten is not just found in wheat-containing products. And a lot of people have like gluten-free corn chips, fried in corn oil. But one of the concepts that I learned, from our last discussion, Dr. Osborne, in your book, is that gluten and other grains have their own anti-nutrients and so forth. I should say other grains have forms of gluten that aren't really called gluten necessarily, or would be sometimes marketed as gluten-free, yet there are gluten forms in them. Can you explain that in a little deeper?
Yeah, sure. So the definition of gluten actually comes from research that was done in 1952. And it was actually done at the University of Alabama, Birmingham, where this protein called alpha-gliadin was discovered. Now, this study was done on 10 people, which is, when we talk about evidence-based medicine, we always say we need larger scale trials that are double blind and randomized and placebo controlled in order to have real, true scientific evidence, right? But this study was done on 10 people where they isolated alpha-gliadin, which is one of the forms of gluten found in wheat, barley, and rye. And they found that this particular type of protein was part of the triggering inflammatory response that created celiac disease. And unfortunately, that kind of was the fundamental foundation for everything moving forward. In essence, wheat, barley, and rye were the grains that people should avoid, but all the other grains were safe, even though the science doesn't really support that. So what's happened up to now? So we go from 1952 to now. We've actually discovered there are more than 1,000 forms of gluten. So when we use the term gluten, we use it as a singular term, but it's actually gluten is a family of proteins. So, corn has its own family of glutens. Rice has its own family of glutens. And these glutens are very similar from one grain to the other. And what we get, and some people react to the rice gluten. Some people are reacting to the corn gluten more aggressively than they're reacting to the wheat gluten. But they're being told corn and rice are gluten-free products. So they're very, very confused. And what they do is they end up going to the cornbread and the rice bread and the pastas and the cereals and things of that nature. And not only are they continuing to get a gluten that's creating an immune reaction that's leading to inflammation and hormonal changes and weight gain and pain, but they're also getting high concentrated levels of those mycotoxins we were talking about earlier. As a matter of fact, gluten-free food products are one of the most concentrated sources in the American diet of mycotoxin. And several studies have shown that there are high levels of mycotoxin in these products. So again, going back to one, alpha-gliadin is only found in wheat, barley, and rye, but corn has a set of glutens, rice has a set of glutens, and that these glutens have also been shown to create the same type of inflammation, in some cases, even more aggressive inflammation than what was previously thought. As a matter of fact, every time we go back and study a grain additionally, we learn about its glutens, and then we compare those people who are celiac or who have gluten sensitivity, and we try to feed them these grains. What we find consistently is the presence of inflammation that just won't go away until we get grain out of their diet.
Wow. So if a commercial product says gluten-free, that they're just looking at alpha-gliadin, is that it?
That's it. Yeah, the FDA passed this law in August of 2014, and basically it's the gluten law, the gluten food labeling law, which states that if a product is free of alpha-gliadin to 20 parts per million, it can legally be called gluten-free. So your oats can be called gluten-free, even though they're not. The corn can be called gluten-free. The name of the gluten in corn, the main one, is zein, and Z-E-I-N, and that particular gluten has actually been shown in a study in 2012 to create more inflammatory damage and bind with the nuclear receptor, the genetic receptor that gluten binds to in human immune cells, better than wheat. So corn, in my opinion, is probably one of the biggest fundamental grains that people fail to avoid and continue to maintain their illness as a result of it.
Gosh, that's really scary stuff. But I'm glad we're having this conversation because gluten-free has almost become synonymous with healthy. You know, people, if they see gluten-free dessert, gluten-free beer, it's almost like 0 calorie. That's kind of the mindset. So people almost gravitate towards it, and they wonder why they're still overweight and sick, and like we're talking about today, have pain and other issues. So, you know, the diet is really tough for people sometimes just to eat real food. So what are some strategies to help? Well, I guess first of all, people have probably had chronic inflammatory immune responses if they've been eating even gluten-free products for some time. So talk to us about this transition for people, you know, to eliminate the pain and kind of calm down this inflammatory response. Are any, can you shorten the learning curve so that they can, take some supplements or do some exercises? What do you have in terms of advice?
Yeah, there's a number of things that can shorten the learning curve, and the first thing is to change the diet. I mean, you know, the whole premise here is input equals output, right? So if you put in foods that create inflammation, then your output is going to be inflammation. And if you're already inflamed and that inflammation is leading to chronic degenerative pains, whether it be your low back or whether it be some other tendon, ligament, joint, etc. We even have patients with what I call hormone pain. You know, the grain itself is affecting their ability to make thyroid hormone, or it's affecting their ability to make adrenal hormones. And so they can't fight inflammation as well, or their metabolism slows down, or they're lethargic and they have low energy. So it's not just physical pain per se. It can be hormonal pain. It can be other forms of pain that we don't classically consider. You know, acid reflux is painful, but it doesn't happen to the joints, but it can be caused by grain. So from a very simple perspective, you know, the easiest thing to do is avoid grain. And that's, you know, wheat, barley, rye, and oats, also corn, also rice, also sorghum, millet, teff, triticale. Those are your kind of your main grains that are being used in the US today. So gravitating away from those is certainly going to change the input, which is going to lead to a reduction in inflammation and pain. But secondary to that, how do we speed up that curve? Well, one of the ways, there are a number of supplements naturally that can help fight inflammation. But I would say this, I would caution people from jumping on that bandwagon too aggressively, because we want to know whether the diet changed the pain. We don't want to know whether the supplement, you know, artificially manipulated or controlled the pain, right? Now, we can use the supplement to reduce pain in somebody whose quality of life is so poor that they just need more help. And I do that very commonly in my clinic. But if you're just, let's just say you're just the average guy trying to ride his bike 3 or 4 times a week, but your knees are always hurting, or your hips are always hurting, and it's really hard for you to do that, you know, I would say take the diet consideration first. Let's see how much pain relief you can get as a result of that. Now, one of the other things I recommend people do, and I like this analogy, Mike, because if people understand this analogy, it'll make better sense. You know, if you roll over in your car, you're driving in your car, and let's say you roll over a nail and you puncture the tire, you can take the nail out of the tire, right? And your tire's still flat. And that's like removing grain. You can remove the grain from your diet, but the damage, i.e. the flat tire, is still there. And so sometimes the body can heal the damage on its own. Its own innate intelligence will kick in. If your other nutrition and everything else is solid, the body will heal. But let's take that person who's been damaged for 5 or 15 years, you know, 5, 10, 15 years, long-term inflammatory damage. Sometimes these individuals have developed key nutritional deficiencies. They've developed zinc deficiency or vitamin C deficiency or omega-3 fatty acid deficiency. So their body doesn't have the nutritional tools, right, to fix that broken tire, so to speak, right? And so one of the things we do in our clinic is we measure these nutrients. We actually do blood tests that can measure a person's nutritional status so that we can target supplement them as an individual. And that way we're very accurate, and we're not wasting, you know, hundreds of dollars on supplements a month trying to hit the mark with something that they may not even need. So it really allows us to dial it in and really accelerate their healing curve to a much quicker level.
Before we talk about the testing, something came up, and I didn't want to interrupt you because you were on a roll right there, is the hidden glutens in food. And so, you know, one thing, for example, like, and I learned this in the last year, is like sushi rice is rolled in wheat. And there's other ways that, and rice, I think, would be avoided anyway due to the different gluten type forms in rice and so forth. But any hidden forms of gluten or other anti-nutrients related to gluten in the diet that people should be aware of and that you find patients struggling with?
Yeah, a lot of your condiments and salad dressings, soups, if you're going to a restaurant, they're thickened oftentimes with wheat. Sometimes the meat is injected with a chemical that mimics gluten called microbial transglutaminase. Same thing with cheeses and dairy. That's why so many people As you know, with your expertise in autism, that gluten-free, casein-free diets are more effective than gluten-free diets alone, and that's one of the reasons why is the way dairy gets processed with that chemical called MTG. So, if you're looking at processed dairy, understand that it can mimic gluten, even though it's not gluten, and that's something that a lot of people don't understand. But then you also there are a lot of other hidden sources. If you went out to eat, for example, cross-contamination in the kitchen. There may be some hidden breadcrumbs in your salad. Maybe they pulled the croutons out by hand because they forgot at the end before they brought the salad out to you. Maybe it's in your ketchup in the form of a fructose corn syrup, and you didn't realize that there was corn syrup in your ketchup. So there really are, and you have to be really diligent with reading your food labels. We actually have a list. I've compiled a list of all those kind of tricky terms that if people are kind of wanting to know, okay, what is it, like, for example, hydrolyzed vegetable protein, who knows that that's wheat, right? Who knows that that's actually soy? Not very many people do. So we've compiled that list of food ingredients that you might find on a label. People can find that on glutenfreesociety.org. There's a big marker that just says gluten in foods, and I think it says something like to the nature of the list, like get the list of the hidden terms for gluten, and that's free for anybody who wants it. Just go there. You can print it out if you want to become more familiar with those hidden glutens.
Awesome. Now, I didn't want to interrupt you. I think you want to dive into lab testing. And so one question kind of comes to mind, and this is related to the book a little bit, but I'm sure you get this a lot, is why is gluten sensitivity on the rise? Why is celiac on the rise? And, my thinking process based upon what you told me is that there's all these other factors in wheat, like we talked about the mold, atrazine, glyphosate, but is our immune system changing and so forth? Like, do you want to get into that? And then how would you assess that from a testing standpoint?
Yeah, that's a great question. I think some people are misdiagnosed. I'm a very, very big fan of testing because so many people guess, but they guess wrong, or they guess and they guess from the premise of guilt by association. So kind of what I mean by that is that, if the old thing, if you walk out and the driveway's wet, you assume it rained, right? But what if it didn't rain? What if the hose broke? What if the sprinklers were on? What if somebody washed their car? There's other possibilities. And we have to be careful, especially in science, of making the claim of guilt by association. So when it comes to gluten sensitivity, gluten sensitivity is not a disease. It's no more a disease than a peanut allergy. If a person's allergic to a peanut and they eat a peanut, they pay the consequences of eating the peanut because they're allergic to it. Well, gluten is much the same way. The sensitivity is a state of genetics, and we look at genetic markers to help identify whether a person is gluten sensitive. So, in essence, what happens if a person has certain subsets, it's similar to these SNP tests that like 23andMe and some of these other companies are doing, only it's to a much greater degree more specific and sensitive for gluten specifically, in that we're looking at genetic patterns. And if a person has certain genetic patterns, and the name of the gene we're looking at is called HLA-DQ-A1 and HLA-DQ-beta1 gene. If a person has certain genetic patterns on this gene, then their normal reaction to gluten exposure is going to be inflammation. And so again, it's not a disease, it's just the way their body sees it. Their body sees that gluten protein or that family of gluten proteins more as an enemy as opposed to a friend. And so the more consistently they consume gluten over time, the more inflammation they create until their body hits a breaking point. Our bodies are adaptive, they're resilient, they can adapt to a certain point, but when the proverbial straw breaks the back, it really breaks the back, and that's when disease starts to show up. And there are about 190 different forms of disease that we know gluten can either contribute to or cause directly. And that's why it can get so confusing, because most people think that celiac disease and gluten sensitivity are the same thing, and they're not. And we can make the statement that everyone with celiac disease is gluten sensitive, but we cannot make the statement that everybody with gluten sensitivity will develop celiac disease. There are lots of other diseases people can develop. For example, Hashimoto's, hypothyroidism, type 1 diabetes has the same genetic linkages. Autism, bipolar disease, schizophrenia, depression, IBS, ulcerative colitis, Crohn's. There's all kinds of autoimmune diseases that exist as a result of gluten exposure. And it's not just gluten. There are other factors in the environment that can contribute to autoimmune disease, that brings us to the second half of your question, which is why do we see a greater degree of prevalence of gluten sensitivity today versus, let's say, 50 years ago? I think one of the reasons why we see it is the general recommendation put forth by the government. You see that food guide pyramid is only about 30 years old. And when it initially came out, it didn't come out as this scientific document that scientists got together and created. It came out as a government policy to promote agriculture in the United States, the USDA. And so, but it was taken as gospel scientific truth, and it was taught in schools for years. And so we indoctrinated an entire generation of people into the thought process that if they didn't get whole grains, that somehow they were going to be more or less unhealthy, right? And so that one is that the recommendation went up. Two, a lot of our flours that are made today, the wheat flours and the other forms of flour, we add gluten to them. We literally take vital wheat gluten and we add more to it. And the reason why is it changes the palatability of the grain when it's cooked. It makes it doughier, makes it chewier. So it brings about a greater desire. You know, these pizza crusts that you see coming out that are chewy and stretchy, and, you know, same thing with the pastas and the breads. You know, these things are designed for humans to consume. I mean, the companies that make them want more customers. So they create a design, right, of a product, an end product that the customer it's more palatable for the customer. So they like it more, they chew it more. It doesn't break, it doesn't bleed the roof of their mouth because the bread is so hard that it breaks in their mouth, right? As the old tradition was breaking bread, not chewing bread. Right? There's a reason why, because bread used to be a little bit crispier and a little bit harder. So we've added gluten to the grain. So we've got a much higher concentration of gluten-based grain items. We've got a governmental policy that says eat more grain. We've got government tax subsidies going to grow more grain to feed the poor. So it's kind of a culmination of all of these things happening. And then you also add the fact that antibiotic use is on the rise. And now we're seeing the 50-year kind of mark of what antibiotics has done to the biome, to the microbiome in humans. And it strips away. There's 5 barriers in our gut. I talk about these in really big depth in the book, but there's 5 barriers that protect our gut from developing a leak and an autoimmune disease process. And one of those barriers is the microbiome. It's the bacteria. And so a lot of antibiotic use will take somebody who they're already probably reacting to gluten. They're just not allowing that reaction to leak into their bloodstream and go systemic and start affecting all of their tissues. It's isolated and localized to the gut, as it should be. The gut's job is to keep things that are bad for you, you know, in the gut and then poop them out, right? It's not designed to let those bad things come through. So if those 5 barriers are breached in your gut, then that's when people start manifesting more and more symptoms. So antibiotics, because they strip away one of the major barriers. But not just antibiotics. Many of the blood pressure medications also create a leaky gut. There's actually research now showing that certain classes of blood pressure medication actually induce leaky gut and mimic celiac disease. So cause all the same kind of barrier leakages, making a person more prone to that gluten reaction. We have drugs like aspirin and ibuprofen and other non-steroidal anti-inflammatory drugs. And these drugs have been shown to strip away one of the other barriers, the mucosal barrier. It's the layer of mucus that coats the GI tract and the stomach and protects it from chemicals and other things penetrating into our bloodstream. That barrier is stripped away by these medications, which makes it so ironic that we take a pain medication, right, to block the inflammation, that the pain medication deficiency didn't cause the inflammation, but we use it to artificially manipulate the inflammation. And in the long haul, we actually induce a leaky gut as a result of that. It leads to a perpetuation in the inflammation. And then we've got other classes of drugs. I mean, there's so many different classes of drugs that affect the GI tract, whether they affect the microbiome or whether they affect the mucosal barrier or whether they affect GI motility, like how the GI tract and the nervous system communicate to push contents of the gut out. Because so many people suffer with constipation that one of the things that happens is the toxic food that they're eating stays in the gut longer. So now we got this putrefaction and rotting that's occurring in the gut because they're not having bowel movements on a regular basis. And so the bacteria are trying to help out, and they're eating this food and they're producing byproducts that potentially create inflammation, and it can cause more leaky gut. So we get this kind of vicious cycle that just continues to perpetuate. So it's not, that's why I wrote the book, because it's more than gluten deep. Everybody's all, you know, we've bastardized gluten to this point that it's public enemy number 1. But I think it's more important to understand that, look, not everybody's gluten sensitive, but there are a lot of people that have problem with grains as a whole, because their gut's in turmoil already. And grain as its own nature is a seed, and seeds are already anti-nutritive, hard to digest, hard to process. We take a broken gut, we dump pounds of seeds into it every day and expect that that broken gut is going to have the capacity to appropriately digest it without symptoms or side effects, and it's foolhardy. And we've kind of lost sight in the in-tuneness of diet being important in health in this country. And I think we're coming to a head. We're coming to I call it a functional medicine head, where people are starting to rediscover functional medicine, which really is nothing more than nutritional medicine, as you know, just being renamed under a broader scope.
Yeah, really exciting stuff there. I love that last soundbite. I think our listeners are going to hit the rewind button to check that out again. But Dr. Osborne, a couple things came to mind, and a lot of friends that I know that are not in the health space are not necessarily sold on the gluten-free thing, where their response is, "Oh yeah, I eat wheat and I don't have any problems. I don't have any GI issues or upset." And so, this connection between systemic and delayed onset ailments like autoimmunity or neurologic disorders, Alzheimer's, what have you. What sort of tips would you say to them, for people that have friends that are not really committed to get off the grains? And then we'll finish off with pain. But what do you say to that in terms of like, okay, yeah, this stuff does take a while to brew. Just because you don't have symptoms doesn't mean it's not having an impact. Any words of wisdom?
Yeah, I mean, that's a great question, Mike. I think there are a couple of things that I could say. One is that you want to understand that the only known forms of acute disease, right, are either trauma, gunshot wound, knife stab, car accident, stuff like that, or infection, where we're running 100, 300, 4 fever. It's obvious we're sick. We know we're sick. All other forms of disease, for the most part, are chronic degenerative, meaning you don't wake up one day and you have diabetes or Alzheimer's disease or heart disease. It's a progress, right? It's kind of like you don't wake up one day overweight. It's a process where you've neglected your body and you've lacked the exercise and you've eaten improperly. And over many, many years, you put a pound on this year, another few pounds the next year, and it accumulates over time. So the chronic diseases that we face as a whole society today are bioaccumulated damage over time. And we're foolhardy if we're saying that, hey, this doesn't affect me in any way. There's no way, because I don't feel it directly. I don't get fat tomorrow because I don't exercise today. But if I don't consistently exercise, then my morphology, my anthropometric data, my body fat composition is definitely going to change toward a negative effect and increase my risk for developing a number of different diseases. So that's kind of one fundamental thing to think about. But the other thing is delayed hypersensitivity responses, which, by the name, delayed, means that it's alternative of acute. Acute, if we define an acute allergy, the response comes within generally 0 minutes to 30 minutes, meaning there's this kind of window where we'll feel a symptom. The lips will swell, the throat will constrict, we'll break out in hives, we'll cough, we'll itch, we'll wheeze, we'll sneeze, we'll have watery, teary, itchy eyes. Those are kind of the acute onset symptoms. Not everybody has acute onset symptoms. There's two sides of our immune system. There's the acute side and then there's the delayed side. And kind of think of this as almost an analogy to, when you think about somebody who gets a virus, and there's this latency period, right? You get a virus, you get exposure, and you're not like sick right now because the virus got through your tissue. There's a 7-day, 14-day, 21-day latency period before your immune system really starts to ramp up and you really start to manifest symptoms. And delayed hypersensitivity works on that same side of the immune system. It's called the delayed side. And so we make antibodies on this delayed side, IgG and IgA and IgM and IgD antibodies. There's 4 different classes. We make something called a T cell response, which is a specific type of white blood cell directly will have this response of chemokines and cytokines and other chemicals that it can create as a result of exposure. But it takes time for these chemicals to ramp up. And then we have another kind of a response called an immune complex response, or the complex response. And so, those 6 other forms of delayed response, very few doctors measure them, unfortunately, because very few doctors are experts in immunology. And even most of your allergists are only measuring the acute side of the equation, that 0 to 30 minutes with a skin patch test or a skin prick test. Mm-hmm. So you've got this delayed response, and the window is it's 3 hours to 3 weeks. So you can eat something and you don't necessarily have to feel bad immediately, but that inflammation can again, it's accumulative over time. So maybe it takes you 2 or 3 weeks and you're really mounting this immune response, but it's not so violent that it puts you down. Maybe your body is resilient enough to kind of bounce back from that inflammation. But again, it's that as we accumulate that damage repetitively over and over and over and over again, the body loses its ability to adapt to that chronic inflammation. And what eventually happens is we fall prey to the disease. And that's when we get the diagnosis. When the disease becomes so obvious, we can no longer ignore it because our body has lost the ability to adapt to what we've done wrong to it. And again, that's when the diabetes sets in. That's when the chronic pain syndrome set in. That's when the autoimmune disease sets in. It's not an overnight process. It can take 2 to 3 decades.
Mm-hmm. Yeah, beautifully said there. So you kind of lose your resilience slowly over time. And then it's like, going away for folks with children, like if you're with your child every day, you don't see them grow necessarily. But if you're gone for a week and come back, you're like, oh my gosh, you grew a half an inch or something along those lines, or a pet or what have you. You can see that so your baseline kind of it's more subtle, that change. So I really like that. Now let's go back to the medications. This is the other thing I wanted to touch on. And today we're here to talk about pain. The pain meds, particularly the opiates, affect the GI tract. And we've had other guests on the show talk about small intestinal bacterial overgrowth and motility issues induced by taking pain meds. So this is why it's so important, Dr. Osborne, for people to know this and have your information in your book, because what a great alternative to avoiding some of these caustic medications, the opiates, which are addictive and harmful for the GI tract. So maybe let's talk about why pain meds are not the right way to go for pain.
With inflammation, I mean, if the pain is inflammatorily induced, meaning if the pain is caused from a source of inflammation, we can block the inflammation, or we can block the way that we perceive the information. And so some of the opiates do just that. They block the way we perceive the inflammation in our brains. And they create they're highly addictive, and they create a severe habit forming issue that over longer periods of time, a person loses their tolerance to the drug, and they have to take more and more and more to get the same effect. But the side effects of the drug is they completely lock up the GI tract. So we get severe constipation. And so now again, we get food that's putrefying in the gut. We get the gut that can't move, so the food rots internally. And that's going to set the stage for dysbiosis or abnormal gut flora. It's going to promote yeast overgrowth. The problem with that, Mike, is now when we promote yeast overgrowth, when you feed yeast in the gut grain, they convert it into, in a sense, alcohol. You actually develop your own distillery. So now you've got an alcohol problem, even though you're not an alcoholic. And so over time, it can lead to liver damage, which, remember, many of these opiates are processed via the liver. So now you've got these drugs going through the liver, you've got alcohol coming in because of the dysbiosis caused by the drug, and you've just created and set up a vicious cycle that is never going to be fixed, no matter how many drugs or how many artificial chemicals you throw at it. And the same goes with supplementation. Although I will, to try to wean or help somebody get off of their pain medications, I'll use things like strong concentrated doses of omega-3. I'll use things like high concentrated versions of turmeric, 95% curcuminoid, high concentration, 1 to 3 grams a day, as a tool so that they're not in such severe pain as they're trying to titrate off of these other drugs. Again, some of them are addictive, so that the side effects of trying to wean off, chills, fever, the symptoms of weaning off can be almost just as bad as the pain itself, because of the addiction. And so we really want to try to make the quality of that patient's life much, much better as they're making that weaning process. Because for some people, it's not just, okay, I realize the drugs aren't good for me, I quit, right? It just, there's got to be a kind of a monitoring weaning process that goes along with that. And so, but ultimately what your listeners want to understand is that those pain medications do not fix the origin of the pain. They mask it. And if you mask the pain, what you're doing in essence is you're allowing your body to believe that it can continue to go on, right? So let's say it's physical pain in the knee or physical pain in the shoulder. Now you keep lifting weights, you keep riding the bike, you keep running, you run through it because you're blocking it and you don't feel it. Now you're detrimenting and deteriorating that joint to an even greater degree, and you're setting yourself up for replacement surgeries, other forms of surgery, doesn't matter the form of surgery, but you're setting yourself up for complete demolishment of that joint and much more aggressive medical intervention later down the road, which the problem with that is now you've got this high state of inflammation. Now you want to go induce more inflammation by scheduling a traumatic surgery, right? And so you're already not healing. And so now you've induced this surgical damage in an attempt to try to heal it, but your body isn't in a place where it can heal. So many people have a kind of a non-surgical response. They have what's called failed surgery syndrome, where the surgery didn't do anything other than make the problem worse, because now they have all this scar tissue that their body's trying to heal, and they're already overly inflamed. And so now their body is busy trying to heal the wound instead of repairing the damaged joint that was originally damaged in the first place. So we get this, it just becomes a vicious cycle. So the way out of that, I call it the prescription pain trap. And the way out of that is you've got to, one, educate yourself that the drug isn't the solution. It may give you a temporary fix. And in that sense, Okay, but what's the long-term plan, right? You can't use the drug forever. So what's the real plan? What's the long-term plan? And it has to be comprehensive. And part of it has to be, part of it, if it's a physical pain, has to be rehabilitative in nature, meaning you've got to address muscular weakness, muscular imbalance, proprioceptive imbalance, neurological problems. Those are, very important issues to address. But the other part, and that for most people is an area that gets addressed. A lot of chiropractors, a lot of physical therapists address those areas fantastically well. But the piece that gets ignored by most is this nutritional piece. You are what you eat. If you're gluten sensitive and you're eating grain, you're a train wreck waiting to happen. If you're not gluten sensitive and you're eating grain and you're chronically inflamed, and maybe you have this mold reaction, maybe you have a heavy metal response because some of these grains are high in mercury and cadmium and arsenic. Those are things we really didn't talk about yet, but some of these grains are high in pesticide and creating. I mean, again, it's multifactorial. It's not just gluten. If you suffer with chronic pain, and here's the kicker, if you suffer with it but you don't know why, and your only solution has been to medicate, then you're on a road to disaster, and you need to get intelligent about it, and you need to take a more meaningful approach. And that begins with what you put in your mouth.
Very important stuff. And you talked about vicious cycles, and in your book, I love you have a lot of charts and diagrams and circles to really educate people about what's going on here. And one of the vicious cycles that I've experienced, and again, I have this in your book, is you talk about how pain causes depression. And then that leads to immobility and loss of muscle. And we've talked about muscle before on some of your programs. Talk about some of these vicious cycles and what you see with patients, and why it's important, again, just to reinforce cleaning up the diet to kind of remove the source of this.
Well, the grain depression cycle is very clear in that many people react to grains, and it affects their nervous system. So it's going to affect their capacity to properly generate neurochemistry. In other words, for nerve message to be properly communicated, and so they can actually develop a state of depression. Goes way back. I mean, one of the earliest known names of gluten sensitivity is called bread madness, because it could actually induce for many people a schizophrenic state, so altering of the mind. But just like grain can create a leaky gut, it can also create a leaky brain. And so what it does is it opens up the blood-brain barrier and allows chemicals that don't belong in the brain to have access to the brain, which then sets the brain up for chronic inflammation. And one of the side effects of that is depression. So what does a person who's depressed do? Well, they generally don't want to exercise. They're depressed. So that they have a kind of a suppression of their desire to get up and be mobile and be active, and then that sets the stage for a further deterioration of their joints and muscles, right? We there's the old saying, use it or lose it, and bone grows based on a law called Wolff's law, which means that bone grows based on pressure. So where there's pressure, there's increased bone density. That's why people who don't exercise tend to have more bone loss than people that do. That's why astronauts that go into outer space where there's no gravity and no external force or pressure on their bone lose their bone density the longer they're in space. So we have that fundamental law. Then we have the law of muscular growth. And that law is that if you put muscle under pressure, it will grow. It will grow in strength. It will basically increase in size and increase in strength and increase in oxygenation, increase in blood flow. It will help you utilize blood sugar better. So it will regulate your blood sugar better and prevent obesity better. So, when you're depressed, you don't feel like moving. So the act of not moving leads to deterioration of the muscle too. We don't use it, we lose it. But in the joint, one of the most fundamental things that you want to understand is that blood supply reaches your muscle, but blood supplies don't reach joints. Joints do not have a direct blood supply. They are nourished through the synovial fluid that bathes the cartilage. And the only way that happens, that nourishment occurs through motion and movement. So if we have somebody who's sedentary, sitting at a desk for 8 hours a day on a computer, somebody who's inactive and just got it, whether it's a job or whether it's depression and they're just not exercising, their joints deteriorate faster. And so again, it sets up a vicious cycle. You can develop pain just from being sedentary. Sit for 8 hours and see how stiff you become. Now multiply that for 5 years and throw grain into your diet and throw other bad things for you into your diet, and you're going to set this cycle up to be quite prolific. And then that leads to another cycle called the grain-obesity cycle, which is, for many people, the grain itself actually induces hormonal change. Because it creates inflammation, it causes your body's normal response to it is to try to make more cortisol. Cortisol is the hormone we make to fight inflammation. That's why if you ever had a joint injury, sometimes doctors want to inject you with a corticosteroid. They want to inject you with a steroid or give you an oral steroid. That's cortisol, right? Your body makes cortisol to fight your own inflammation. But if you've been eating foods that are chronically inflammatory and you've been forcing your body to try to overcompensate by making more and more cortisol. Again, you multiply that by 5 or 10 years and you're going to end up with adrenal burnout. And then that adrenal burnout or that adrenal failure leads to an inability to adapt or cope to the inflammation. So then the inflammation, now you have no fire trucks to put it out. And so now it just gets out of control. And when your adrenal glands get worn out, you've got big problems because now your natural inflammatory control mechanism is gone. And so one of the things that happens as a side effect of that is excessive insulin production. And so then we start storing fat. Cortisol causes bloating and retention and water weight gain, and then insulin causes fat storage. And so then we get in, because we're inflamed and because we're eating the wrong foods that are creating this inflammatory cycle, and those hormones, they're changing over time. They're changing and they're making more and more and more. And then we actually end up in this state of fat storage. And so we end up marbleizing our own muscle tissue. Just like you take a cow and pin it up to marbleize the meat, you end up marbleizing your meat. And so your muscles become marbleized. They become less muscular. They become more fatty. So you develop a fatty muscular tissue, and then your metabolism drops because muscle sets the metabolic rate. Muscle is the #1 determining factor for whether or not you're going to be successful losing weight, and whether you have enough or whether you don't, because the act of having muscle allows you to burn more calories at rest. And so if you're marbleizing your fat, your metabolism will slow down. And if you're eating the same quantity of calories today that you did 5 years ago, only today your muscles are marbleized and don't have the metabolism, you're going to slowly put on more and more weight. And then that excessive weight plus gravity on your joints compresses your joints, creates more wear and tear, creates more cartilage damage, makes it hurt, makes it painful to walk. And so now you're avoiding exercise and activity altogether because you've gained the weight, and the actual physical gravitational force plus the fat increase your pain. And so you've developed this stance of, oh, it hurts to exercise, so I'm not going to. Right. But you haven't changed your diet. So you continue to create dietary inflammation, which continues to cause you to gain weight, which continues to cause you to hurt when you try to exercise, which continues to lead to weight gain. So you get stuck in the vicious cycle. Again, that's called grainbesity. And it's a hard road to dig out of that once you're really trapped in it, but not impossible to dig out of. It requires, 1, knowledge. You've got to understand that's what's happening. 2, you've got to have a diet change in there. And 3, you've got to introduce the types of exercises that are not going to be so dramatic or traumatic on your joints and tendons and ligaments that it would create, repetitive use or pressure-based inflammation. And just things like whole body vibration or pull work, where you remove the gravity so that you can start the initial weight loss cycle before you can gravitate into exercise, like high intensity interval training and things of that nature.
Yeah. Now, do you see more chronic pain in people that are overweight? Is that a theme in your practice?
It is and it isn't. I mean, I get just as many people underweight or average weight as I do being overweight. I think it's because it can, the old thing is it can, just like grain can cause diarrhea, it can also cause constipation. Just like it can cause obesity, it can also cause failure to be able to put on muscle. Some people, the grain, the way it affects them is it damages their gut lining to such a severe degree they become malnourished. So no matter how many calories they're really eating, they're not absorbing the vitamins and the minerals, so they can't actually put on the muscle. And plus they've developed autoimmune disease, so their immune system is stealing protein from the muscle to try to fight the food. And that, again, that sets up an environment where they're incapable of putting on mass if they're underweight, or just the opposite. It creates a hormonal environment that causes them to put the weight on. Again, everybody's different in their response. And that's not to try to say that, hey, grain is a catch-all no matter what's wrong with you. It's just grain. Look, I'm a big believer and advocate in testing. And, it was one of the questions you asked. We kind of sidetracked it, but genetic testing for gluten, to me, is a crucial piece, because if you're going to make somebody change their diet for the rest of their life, you damn sure better have a good justification for doing it. Otherwise, you're guessing. And I like to use the sugar analogy here, Mike. How many people know sugar's bad for them? Everyone, right? But how many people still eat it? Everyone, right? Mm-hmm. Because there's no black and white for them. There's no justification that if they do eat it, what the outcome and what the consequence is going to be, because one is human hubris, right? They just feel like they're immortal. They're young enough where they feel like, I can do what I want and it's not really going to affect me. But the other is because they don't have a parameter that's staring in the face that's saying, hey, if you eat this, this is going to be your potential outcome for sure. And we know that about you. This is genetic. It's not going away. So I'm a big believer in testing.
Yeah. So let's dive in, finish off a little bit here, Dr. Osborne. Wonderful information, by the way. And the other thing I wanted to highlight, and you talk about it in your book, is, muscle is anti-inflammatory in its own right. And you talked about just the act of moving muscle releases myokines that suppress inflammation. So, we're thinking along the same lines here. And that's why I love your book and your work, because you can articulate it so well. And, these vicious cycles, I think, are really important for people to understand so that they can take the steps in their own life to make lifestyle changes and dietary changes to improve their health. But if we could finish off and talk about the 30-day diet plan. And you mentioned earlier that sometimes you don't want to start off with supplements because you want to see if the diet is working. So at what point do we introduce some of the supplements and some of the things to kind of accelerate the healing process here?
Well, there are some supplements that I recommend that we introduce, not because of any other reason than they're essential. So there's two kinds of options when it comes to supplements. There's what we call essential and there's what we call non-essential. And if we define essential, we're defining essential as these are supplements that your body cannot produce internally, but if your body doesn't have them, it can't function. And so like an example of that would be omega-3. Omega-3 is an essential nutrient. And omega-3, what it does is, it's profound in its effect at blocking inflammation. It's profound in its impact and effect at thinning the blood. So we've got these, when we thin the blood, we can deliver more nutrients and more oxygen. So let's just take that person who's been just loaded up on grain. They have the opposite of omega-3. They have tons of omega-6. Their blood is too thick. They've got hyperinflammation. Giving them strong doses of omega-3 isn't medicinal in terms of masking. It's medicinal in terms of their body is so devoid of that particular nutrient. We've got to get it up just to catch them up, just to get them back on par. We're not artificially manipulating their chemistry with an herb. We're actually giving their body the essential nutrient that has been lacking for years because their diet has been so poor. So when it comes to supplementation, the vitamins, the minerals, the essential fats become very, very crucial, because you've got to have the fundamental building blocks for their bodies to heal and repair, if that makes sense. So, we can surmise that one of the things I would say, if you're not getting the testing done, so if you're just a person saying, what can I do? No doctors involved. I just want to take action steps. One, a very, very potent, strong multivitamin, obviously that's grain-free and preferably GMO-free. Two, a very strong concentrated dose of omega-3. Okay, that's been tested for mercury and been tested for contaminants and lead and other things, so that you're not introducing some other chemical into the equation that could create inflammation. Those two things fundamentally will be extremely helpful. Now, the third thing that can be done that's extremely helpful, that is an essential piece, is proteolytic enzyme. And the reason why is these people that have been eating all this grain as a base of their food, their gut produces enzymes. All of our guts do. But what happens when we eat hard to digest foods is we wear our pancreas down. We wear our GI tract down. And so it becomes deficit. It becomes a state of deficit. So what a proteolytic enzyme does is it helps naturally modulate inflammation. And we would make our own if we didn't have a gut that was in such disrepair and we didn't have a body that was so hyperinflamed. So those three probably would be the ones I'd pull off the shelf first because of their essentiality in this process. And then we could pick and choose other things. If, for example, if they were trying to wean off of a drug, if they were trying to, really, really get aggressive at taking it to another level, but they wanted to use some things that were natural that might advance the process a little bit more. But ultimately, the goal being, don't rely on turmeric for the rest of your life either. Don't rely, so you see what I'm saying? Don't rely on this herb or this concoction or this tincture for the rest of your life either. You've got to get to a point where when you pull all the pills away, it's just you and how you feel, and you should feel great, and you should feel pain-free. And if that's not the case, then you haven't figured it out yet. So those would be that would be my attitude about the supplements if you're not getting tested. As far as the 30-day program goes, I break it up into a 15-day cycle and then a secondary 15-day cycle. And it more for anything, it's just to allow a person to naturally gravitate toward a more meaningful diet. In other words, the first 15 days are not quite as aggressive in the elimination. In the last 15 days, we get more aggressive. And I know that people like graduation, right? They like to be able to say, okay, I need to take it in baby steps. This allows them to take it in baby steps. Now, many of the people, like in my clinic, they don't do baby steps at all. They go right to the full-fledged. But we also do very, very advanced testing where we know exactly what foods they should never eat. We know exactly what they should and shouldn't do in terms of supplementation. We've ruled out the 4 primary reasons the inflammation might be there, which are the food, environmental chemicals or poisons or toxins. We've ruled out vitamin and mineral deficiencies and what they need. And then we've also ruled out infections, because some people develop chronic infections that can lead to chronic inflammation and pain in their joints. It's notorious for, especially with people with autoimmune problems. So we rule those things out clinically so that we have the exact action step for that person. But the book is designed to take a person who's not doing, who's not visiting with a functional medicine doctor and going through all this advanced type of testing, but they want to have tools that work, right? And if they just dive into it, it will work. I can guarantee. There's very few guarantees in life, but I can guarantee that if you suffer with chronic pain and you go through that process and you don't feel better, call me. I'll refund your money. I got 16 years of experience in my clinic, and I have no doubt in my mind whatsoever that that process won't work.
Mm-hmm. And by the way, I've been to your clinic. It's a beautiful new office, and you teach doctors, how not only the business side of things, but the clinical side. So I think our listeners are going to be fully convinced, and the way that you articulated this is really awesome. So again, the book, Dr. Osborne, is No Grain, No Pain. It's available January 26, 2016, and I'll post the show notes and links to Amazon, where folks, if they click through that link at highintensityhealth.com/Dr. Osborne, you can help support the show. So one final question I have for you, Dr. Osborne, and this is related to your book, but not really. You run a busy practice. You have a great family. You're writing books and doing all these online educational resources for people at the Gluten-Free Society. What is your morning routine? We want to kind of get to know you a little bit better as a person, and want to know, how do you structure your day that makes you so successful, healthy, and vibrant? It's now 7 o'clock your time, and you're just ready to keep going for another hour, I bet. So tell us about like your daily and morning routine.
So I always wake up around 5. And I'm a CrossFitter. I love to go to CrossFit. It's just a community that I've gravitated toward. I like the workouts. I like the way it pushes me. So, 5:30 workout, and then I'm usually home around 6:40 or so. And then I relax. I relax and recover from the workout, have a little bit of light breakfast. I'm generally not a heavy breakfast eater, but from about 6:45 to about 8:39, I spend a little bit of time relaxing in there, but then it's one of probably my most functional times. My brain is on fire, and it's very, very vibrant at that time of the day, and I can get a lot done. I can get 2 to 3 times more done mentally in that early morning time frame, because I'm not interrupted by other things. Nobody's bothering me. It's just kind of me in the world. And so I can write, I can blog, I can shoot videos, I can think about the patients that I have for that day and kind of prepare for my clinic. So it gives me that opportunity. And then my clinic starts at 9. And so generally I'm in with patients from about 9 to about 4. And it just depends on the day, but it's usually like that Monday through Wednesday. I work 3 days a week in the clinic. And then from about 4 on, I'm doing more prep work. I'm doing more writing. I'm catching up on patient notes if I have notes to catch up on. But in the midst of that, I usually bring my lunch to eat in the office, and it's always a home cooked meal, so it's whatever we had for dinner the night before. My wife is very good to me. She makes plenty of food, and she makes the right kind of food, so she supports me wholeheartedly nutritionally, and our children. So, and then when I'm ready to close out my day, now these 2 months here where we're doing this book prep and this book launch is, we're burning a little bit later because we're just prepping and doing so much more because we want it to be successful. And I think, anybody knows that success does come with a price. It doesn't just fall in your lap. And so sometimes you've got to work a little bit harder than others. But in the general course of the week, I really try to get out of my office at a reasonable hour so they can go home and spend some time with my family. I'm only in the clinic Monday through Wednesday. So, I've got Thursday, Friday where I have the option. And usually I'll wake up early those mornings, do a little bit of work, but not a whole day intensive. And then I'll spend time with the family, and I like to take a vacation here and there too. So, there's a balancing piece to this as well. I think if I'm giving advice, doling out advice about lifestyle, it's if you have a partner, the partner's got to understand that sometimes you've got to burn the midnight oil, and sometimes you need to balance, and it's not always a perfect medium. And so, having a partner who understands you, I say that there's always the formula behind every successful man is a very intelligent and very successful woman who sometimes takes the back seat to that successful man. My wife is a perfect example of somebody who doesn't want to be in the limelight and doesn't want to shine that way. She just she's just my wing. She just supports me in everything that I do. So I'm very, very fortunate to have found the right partner. And I think that's very, very critical. Now, if you're not married, then a lot of it just becomes self-motivation, and you've got to be very, very well organized. So you've got to have a meal plan. You've got to have a guide to a meal plan. And so what I've seen a lot of really successful people do is hire chefs. They bring in a chef to cook their meals because they just don't have time to do it themselves. They're busy with whatever it is that they're trying to get done and accomplish. So that works really, really well too. So that's what I would do if I didn't have such a wonderful wife.
Yeah, I remember we had bacon wrap dates and all kind of, like, a lot of people say, oh, we're going to have good, healthy food, but there's always some junk in there. And at your open house, because I think you had just opened the doors in that clinic about a year ago, just amazing food. And so you really practice what you preach. And so there's a great answer to that final question. So Dr. Osborne, how can our listeners learn a little bit more about you? Do you have a website for the book? And if people want to contact you, what's the best resource?
Yeah, so I've got a few different resources for the book. It's nograin.com, and they can learn more about the book and get information about it there. As far as my clinic is concerned, it's drpeterosborn.com, drpeterosborn.com. And if they want to know more about grain as a whole and just get some great free information and education, we have a quiz there too that they can take. If they don't want to take genetic testing, they can do our little mini quiz. It's about 30 questions. And that's glutenfreesociety.org. And I have a huge archive of video libraries and informational blog pieces that anybody can get on there and look at and take a look at for free and get educated.
Well, that concludes this episode of High Intensity Health Radio. Hope you found that discussion informative. I know I learned a lot and was just really motivated and inspired after chatting with Dr. Osborne. A really great guy, as you can tell towards the end. He just talked freely about his life and his structure and his schedule. I find those discussions very motivating and informative. So thanks again for tuning in and subscribing. If you want to check out the show notes, like I mentioned before, do that over at highintensityhealth.com/drosborne, where you can see the first interview that we did with Dr. Osborne. Really took a deep dive into Zane and corn, a little bit deeper than we talked about today. So I think you'll find that discussion informative as well. So with that, we'll catch you on the next episode. Hope you have a fabulous, healthy day.